It's Mari McInerney from Croakey here at the Sarah at Remote and Rural Allied Health Conference in Mildura, and I'm speaking here with Karen Hayes. Karen, can you introduce yourself, your role, and where you're from?
Yeah, so I'm an occupational therapy academic at Charles Sturt University on our lovely Port Macquarie campus, and so I'm working to increase our occupational therapy rural workforce with our beautiful occupational therapy students up there.
Fantastic. Now, you spoke at the conference about spatial justice.
Yes.
I was going to say to you a bit later, but it was an absolute delight to hear about capitalism at a health conference.
Yes.
What brought you to giving that presentation?
Yeah, I think because one of the biggest differences between rural and remote health and metropolitan health is a question of geography. So I started looking into, well, what do geographers say? And one of the things I came across was critical geography and the concept of spatial justice. And that's the concept that everything that we experience, every kind of opportunity that we have is related to where we are in space or where we live. And so I started looking into it, and the more I looked into it, the more frustrated I got with realizing that we've been sold this idea that the reason our rural health outcomes are so much worse is our geography. But in fact, we shape our geography. We decide where we're going to build things, we decide where services are going to be placed, we decide where we're going to put infrastructure. And so the outcomes that we get are a direct result of social decisions about how we've shaped our geography to limit opportunities for people in rural areas to access health.
Now, the powers that be would tell you, well, it's just a question of population. Who can we serve? Who can't we serve? How much does it cost us to serve it? What's the solution?
What's the solution? Well, I think looking at cost from an urban perspective is a bit unfair, because urban people live conveniently close together for people to be able to make a profit from our healthcare. And as rural people, we've had a lot of our resources get removed from rural areas. We get mined, we get toured, we get harvested, and those things go to the city. And so we need a bit of reciprocity. We need people to send back the resources that we don't have. And so the reason that a city is able to exist is because rural areas exist. And so if we're going to fix a problem that is quite significant, when we have women in very remote areas in 2022 had a median length of life 19 years shorter than someone in the metropolitan area, then we need to decide whether our lives are worth more than the money that's being saved and not being spent on us.
So what's your message to the people who are here today? Is it to them or is it to the powers that be? Is there something allied health professionals can do?
Yeah, I think the powers that be, I would really like it if they were starting to think more from a justice perspective than from a cost containment and a limitation of spending sort of perspective. But also allied health, I think we need to start standing up and advocating for our communities. We live here, we have skills, and we love our communities, and we want those communities to be adequately serviced and funded so that we can provide the healthcare that people deserve.
Fantastic. Now, anything else that you would like to add?
No.
Thank you very much, Karen.
Thanks.